Hello, I'm a doctor visiting from the UK, and today we're going to be going through the complete blood count, the CBC. The test is done a lot, and I think sometimes there's a lot of questions about what the test means, what you can read from it. So I'm going to be going through exactly what it means, looking at one of the tests that I had recently. So going through from the start, the first thing that comes up is the white blood cell count, the WBC. That's sort of a marker of infection. So if you have any, or inflammation actually, so any infections or inflammation, that will go up because it shows the body's fighting against something. That's why you produce white blood cells, if you're fighting against something. So if that's high, it means maybe you've had a bacterial infection recently, maybe you've had your body's had inflammation, and that needs probably looked into in more detail. So this is sort of like the preliminary screening test, you can think of it. The next thing is the RBC, so that's your red blood cell count. So the fact that this is low, my hemoglobin is low, means that essentially I've got less hemoglobin carrying oxygen around in my blood, right? So that means I'm anemic essentially. This gets a bit more complex if you're anemic. If your hemoglobin is low, you probably do need to see a doctor and kind of look into that in a bit more detail, because there's it gets quite complex. There's different types of anemia, there's different types of causes of each of those types. So for example, it's a bit complex at this point, but the MCV, that will tell me, mine is normal, so that will tell me what type of anemia, and as a doctor I can work out kind of what might be causing that anemia, because looking at the different cell sizes, it gets a bit complex. But essentially at that point you want to be seeing a doctor, and there's simple fixes. Sometimes it is nutrition, it's to do with your diet and things, it's getting more iron in. At this point, if I got this result, I'd probably want to look at my iron levels, my vitamin levels, my folate levels as well. And if any of those are low, then I would probably be wanting to take those as supplements. But essentially platelets as well, those are quite useful to look at. Sometimes if those are low, there's different causes. It can be nutrition, it can be looking at your liver in more detail. Those are probably the two main things. And then the other kind of four things at the bottom, like neutrophils, lymphocytes, monocytes, and eosinophils, are all looking at those are all looking at infection again. So those will go up if you've had infection. Lymphocytes actually sometimes go down if you've had a viral infection recently. And then sometimes what we look at is the red cell morphology as well, which kind of just tells you different cell shapes. So hyperchromia, that's, if anyone knows Latin, that means low color in the red cells. So mine probably, I can already look at this whole picture and probably assume that my iron is going to be low. But what I want to do is actually do an iron blood test at this point. And the reason you wouldn't do that straight away in this case is because it costs extra money. So essentially I would, in future, I'd probably just go ahead and test my iron levels rather than having to come back or try and add it on later. I hope that makes sense. It's essentially quite a complex blood test. So if you're ever unclear, just speak to a doctor. I think that's it. And we're always happy to be, asked certain questions and things like MedConsult if you're not sure about the specifics. Cool. Thank you.